In that case, I will say welcome to everyone. Good afternoon, good morning, depending on where you are joining us from across Canada. We'd like to welcome you to our second Animal Health Canada webinar. My name is Colleen McElwain, and I am the Operations and Animal Health Manager at AHC. I'm very pleased to open today's webinar and share more information about the Canadian Animal Health Surveillance System. Now, before we begin, I'd like to make sure you're able to participate in English or French in the language of your choice. A slide was on screen as you were coming in, so you would be able to see the instructions on how to join, have the simultaneous translation and also view slides in the correct language. Because that's down now, I'd like to quickly run through that just briefly. So at the bottom of your screen, there's an icon with an option for interpretation, and you can click that to select your language. At the very top of your screen with view options, you also have the option of selecting which slides you would like to see. And right at the moment, I can see the French. And is the other one being shared? Just double check that.
I haven't shared it yet. Should I go ahead and do that, Colleen?
Yes, please. And that will, you should see a notification once those are loaded. And if for some reason you have difficulty being able to select the slide deck or the language of your choice, please indicate that in the chat and someone will be able to help guide you through that process. So for our first webinar, we heard from Dr. Krista Arsenault about the highly complex work being undertaken to prepare for African swine fever should it be discovered here in Canada. Today, we'll learn about the surveillance coordination system in place for animal diseases through the Canadian Animal Health Surveillance System, or through CAHSS. CAHSS is a division of Animal Health Canada and has been working to expand its network over the last few years. CAHSS plays a very important role bringing together animal disease information to support decision-making, trend monitoring, and information sharing. A coordinated surveillance system is important to safeguard animal and human health in Canada, and CAHSS works closely with other surveillance groups across our many regions and work areas to develop a national perspective for animal disease surveillance. I'm very pleased to welcome Dr. Teresa Burns, who is a veterinary epidemiologist. She received her Doctor of Veterinary Medicine with distinction and her MSc degree from the Western College of Veterinary Medicine, and she also holds a PhD in epidemiology from the University of Guelph. Over her career, Teresa has had the opportunity to use lots of different sorts of methods in multiple disciplines to understand the complex issues at the interface of human, animal, and environmental health in Canada, and also in other countries. Her experience working in disease surveillance, risk assessment, and veterinary public health, as well as in clinical veterinary practice, have given her a strong working understanding of farming practices, our food production systems, and rural communities. She is committed to real-world collaborative progress on national animal health priorities. And I'm very pleased to welcome Teresa.
Thanks, Colleen. Can everybody hear me and see me? And can you see my English slide deck for those of you who need to see English? Are our slide deck showing all right, Sam?
I'm just typing in some answers to the to that. So for those of you who are there, go up to the very top bar. Who are having problems with this, so go into there's a green top bar, and then there's a view options option right beside the green bar. And if you select Teresa Burns, CAHSS coordinator, then you'll be able to see the English slides. And if you select the French one, then you'll be able to see the French slides. I'm just typing that in the chat too for others.
Okay, we'll just give everybody a minute to get everybody on the right slide deck. Mm-hmm. Maybe let me know when you think we're good to go.
Okay, see a couple people saying they've got it, so that's great. So hopefully that will help. Again, for those who are just joining us, go to that view options, the top bar, yeah, and choose Teresa Burns for English. I'm gonna mute myself now. Looks like people are getting the hang of it.
All right, I'll get going. And if you need help, please chat, and Melanie or Colleen or Sam will try to help you while I'm talking. So thank you for this opportunity to present on our work at the Canadian Animal Health Surveillance System. Throughout the rest of the presentation, I will refer to the Canadian Animal Health Surveillance System mostly as CAHSS, which Colleen already did in the introduction. So just, it's a less of a mouthful for everyone to say. So the goals of today's presentation are to make everyone more aware of what animal health surveillance is and isn't, to explain the benefits of having a robust and resilient animal health surveillance system and the risks of a patchy system, to give an overview of the current state of the animal health surveillance system in Canada. As a veterinarian who's been paying attention to animal health surveillance for at least 15 years, I think the successes and progress, particularly over the past 5 to 8 years, are a Canadian success story and something that the animal agricultural sector, both government and industry, should be proud to share. That being said, there are always next steps. So I'm going to take the next 30 minutes or so to share some of the successes and discuss some of the next steps. The first few slides are a little bit of theory and background, which I will try to make as interesting as possible with the ambition of making you almost as enthusiastic about animal health surveillance as I am. So to start with, what is animal health surveillance? On the slide, we have a classic definition of animal health surveillance. An even more simple definition is paying attention to what is going on, thinking about it, and figuring out if you need to do anything. And if you do need to do anything, what should you do? One of the legendary professors at the Western College of Veterinary Medicine, Otto Radistitz, had a famous quote, "You miss more from not looking than from not knowing." And I think that is true whether we are trying to assess the health of an individual animal, a farm, an integrated production system, or an ecosystem. So the first part of surveillance is really making a commitment to looking and to putting things in place that allow looking. The second part of the definition of surveillance also has an important phrase, so that action can be taken. In other words, you have the capacity to act on what you see. So why is animal health surveillance important? And why am I and all the other epidemiologists and surveillance veterinarians motivated to do this work? Well, a robust and resilient animal health surveillance system is important because it gives us the capacity to confidently understand the health of our animal populations, to purposefully plan actions and communications, and to track results. On occasion, those actions might need to be rapid and decisive response activities combined with emergency communication.
I'm supposed to coordinate, so that's what I'll do.
So certainly for our foreign animal diseases, that would be the case. But most of the time, they might actually be regularly communicating with the public or various markets that we are paying attention and our animals and systems are healthy, and that we have the data and compelling stories to support that messaging. Okay, this graph provides a little more detail about some of the common purposes of surveillance. It's definitely the most epi-nerd slide in the talk, so please bear with me while I walk us through it. So to orient you, the x-axis represents time. The y-axis could represent a count of cases of specific disease. So for example, a count of the number of positive EIA cases in the Canadian equine population. But the y-axis could also represent a count of signals. And signals are really just signs that we can pay attention to gain animal health information. So things like mortality, movement patterns, and drug sales. So as a signal example, the graph could represent the number of abortions in sows in a specific province or region of Canada or production system over time. There are a couple of key points from the graph. The first is that knowing the baseline is valuable. Now, we may watch a disease count or signal line for years and never see a change in the line, and that is valuable information in and of itself. It shows health and stability in the system and provides reassurance. And of course, without the baseline, it's hard to see changes in trend and assess interventions. So did that new vaccine that we thought would be a Canadian game changer actually reduce disease? And if the trend differs from what we expected, we can then use that information to ask further questions. For example, if disease levels did not go down, is it because the vaccine didn't work, or because it didn't get used because it was too expensive, or there was lack of awareness about it? The second point I wanted to make about this slide is the red and yellow lines around the main trend line. Those are confidence intervals. So basically, how sure are we that the trend line is in the right place? The main point with those is that the more data we have, the more accurate we can be. So the yellow represents less data and the red represents more. Okay, so we made it through the most dense slide, and this is a really important slide now. It talks about the components of a surveillance system. I think the main point here is that in order for a system to be resilient in the real world, it likely requires more than one component. This is sometimes described as a Swiss cheese model, where you think about slices of Swiss cheese stacked together. Each component is imperfect and has holes, but when you layer them together, you're more likely to not let anything through. And for animal health, the blue text boxes list some of the components we use as surveillance tools. So what we have in our surveillance toolbox. Starting on the left, horizon scanning is about looking far out. So one example would be looking for very early signals, like would climate change make the Canadian climate more suitable for ticks in 25 years? And another example is looking far out geographically. Is there a new disease emerging in another country far from us, and do we need to be concerned? In Canada, the Community for Emerging and Zoonotic Disease, or CZED, is an organization that provides great service in horizon scanning for animal health every day. So the next box, observing and telling, is really about farmers, veterinarians, and others paying attention, knowing who to call if they see something concerning, and trusting the person enough to make that call. So we talked about the middle component, monitoring for signals, on the last slide. And it is an important but perhaps underutilized tool in Canada today. Abattoir condemnations is one signal that we are currently working on more fully using for surveillance, both in the federally and provincially inspected processing systems. And certainly going forward, there are many more signals that we could add on to our animal health surveillance system as we progress. So counting cases is about using our Canadian animal health lab data to its full potential. We have excellent diagnostic animal health labs across Canada that receive samples from veterinarians and test for diseases and antimicrobial resistance every day. So we really need to strengthen our ability to use this data fully for surveillance. And finally, active testing is purposefully testing animals for a disease of interest using a well-defined sampling plan. The National Bovine Spongiform Encephalopathy, or BSE program, would be an example of that. Active surveillance tends to be one of the more expensive components of a surveillance system, so we need to be sort of careful about how we're deploying it, making sure we're using it effectively and efficiently. Okay, so now I just want to spend a few slides talking about the birth of CAHSS up till the time I became the coordinator in 2019. Now, I wasn't here for this phase, so hopefully I'm telling the story accurately. In 2010, National Farmed Animal Health and Welfare Council was formed. In 2011, Council commissioned a technical working group to make recommendations on improving animal health surveillance in Canada. The working group published the report, Surveillance in a Time of Transition, which strongly recommended strengthening the system that existed at that time. CFIA stepped up to provide leadership on CAHSS until it was transferred to National Farmed Animal Health and Welfare Council, now Animal Health Canada, in 2019. So this summary is from a 2017 slide deck shared with me by CFIA, and I do think it does a good job of explaining what CAHSS is supposed to do, so I will just give everyone a moment to read it. All right, I wanted to highlight a couple of phrases. So under point 2, untapped sources, this really means data that is already being generated by someone but is not being fully used for animal health surveillance. For example, so this is a hypothetical example, maybe there is a flock mortality data being recorded by broiler farmers as part of an industry program, but each farmer just writes down the mortality data on a piece of paper and the papers go in a binder. So nobody can easily look at all the mortality data across all the flocks as a signal of flock health. Or maybe it is animal movement and contact data from auction marts. Really, the goal is to know what data is out there and to make use of it to understand more about animal health. The second point I wanted to mention is under item 3, trust. I think everyone recognizes that in order for an individual or an organization to share data or information, especially about something sensitive like disease or health, there must be trust that the person or organization receiving the information will respect the provider. And building trust requires purposeful baby steps over time. It can't really be mandated or rushed. You just have to keep working at it by building relationships. Okay, so moving on, in mid-2019, National Farmed Animal Health and Welfare Council, or now Animal Health Canada, received funding for CAHSS under the Canadian Agricultural Partnership. At that time, Council was able to hire a full-time coordinator for CAHSS, which is me. And then in 2020, we had the good fortune to add Dr. Doris Young to our CAHSS team as the communications lead. In addition, and importantly, our partner organizations that had been supporting CAHSS prior to this kept up in-kind support, as they had done for many years. And these HR resources have allowed us to plan and implement CAHSS activities in earnest over the last few years. So the next area I wanted to focus on is what we are doing at CAHSS now, since the CAP funding was secured in mid-2019. So before we get too far into that, it is important to point out that the Canadian animal health surveillance system at large relies on many agencies working together. On the left, you can see some of the major public sector organizations that are integral. In addition to these agencies, each provincial and territorial government has staff that work to support animal health surveillance. Also, the regional animal health surveillance networks across Canada are important. They include ATCAN, or the Atlantic Canadian Animal Health Network in the Atlantic region, Réseau in Quebec, OWEN in Ontario, and the Western Canadian Animal Health Network, or WECAN, across the 4 Western provinces. Finally, our national and regional animal sector and veterinary groups each contribute to surveillance in addition to their many other activities in animal health and welfare. So as we go through some of our CAHSS work in the next slides, it's important to recognize that all the work that we do at CAHSS is collaborative. So these are the 3 key work areas for CAHSS. Enhancing animal health surveillance is the largest activity and is the focus of much of our efforts. Nonetheless, we are paying attention to building CAHSS as a sustainable organization over the longer term. So in terms of CAHSS governance, there has been a lot of progress since 2019, and I think it's of value to briefly provide an overview of the current governance structure. So CAHSS is a division of Animal Health Canada, and we work with the other Animal Health Canada divisions and projects, so National Farmed Animal Care, Animal Health Emergency Management, or AHEM, the African Swine Fever Project, and the Canadian Livestock Transport Program, on both processes and activities with a focus on value and efficiency. In other words, we try to share access to things such as IT tools and training, and we work together on specific activities or topics whenever it makes sense to do so. And of course, all of that is under the leadership of the Animal Health Canada Council and staff. The Animal Health Canada work on African swine fever is a good example of a cross-division topic. And Dr. Arsenault provided lots of details on that work on the Animal Health Canada webinar last month, and I will speak a little more about it towards the end of the presentation today. So while CAHSS does report to Animal Health Canada, we also have a CAHSS governance charter and a strategic plan in place that guide our day-to-day work. Both of these were developed in the last 18 months and are published on our website. And we do have a CAHSS steering group representing various industry sectors and public sector organizations that provides on-the-ground leadership for CAHSS. Currently, Dr. Glenn Deiser is the steering group chair and Dr. Ashley Whitehead is the vice chair. And the full list of the steering group is available on the portal or login side of our website in the membership directory. All members of the steering group do this work as an in-kind contribution to support CAHSS. So within our major activity, enhancing animal health surveillance in Canada, we have 4 work areas I wanted to highlight today: building people networks, information sharing, building national capacity, and collaborative surveillance projects. We have quite a few initiatives that fit within these key work areas, and I'm just going to showcase a few of these now. So CAHSS is designed as a network of networks. The networks are one of the fundamental components of our system. We have beef, poultry, small ruminant, dairy, aquatic, antimicrobial use and resistance, equine vector-borne disease, and companion animal networks. We also support the work of the Canadian Swine Health Information Network, or CSIN, which was Canada's first national species-focused animal health network and really a trailblazer in this area. We also have a smallholder working group that looks at the smallholder sector. So far, the work has been mainly focused on pigs and poultry and just bringing people together that work in the sector so that everybody knows who's doing what. So each network purposefully brings stakeholders together every quarter to discuss animal health, identify surveillance priorities, and plan and coordinate surveillance activities across Canada. That being said, each network is a little bit different. Most of them include representation from animal and agri-food industry organizations in the veterinary sector, our federal, provincial, and territorial governments, animal health laboratories, and universities. Most networks have a chair from industry and a representative to the CAHSS steering group. And again, all of this is in-kind contributions to support CAHSS. So we currently have 350 active members. Some belong to only one network and others belong to several networks. So in terms of information sharing, one thing we are proud of is our CAHSS website at www.caahss.ca. It was launched about 14 months ago. It's a centralized information hub with lots of different tools that are useful for veterinarians, producers, and laboratorians, as well as others that work in animal health. CAHSS tools are available in both English and French and include a resources library, a surveillance initiatives library, a disease alerts page, and a regulated disease table. So in our resources and surveillance libraries, we try to have a searchable tagged list of all the surveillance resources that are available across Canada and all the surveillance initiatives that are going on across Canada. And what we do is we'll have a summary available of each resource in English and French. And then if they're resources that are created by CAHSS, we have a link to the full text. But if the resource is created by another organization, then we link to the original site so that the organization who did create the resource is clearly identified as the author. And then we also work with CFIA to publish various dashboards on our website. The equine dashboard provides counts of important equine diseases, and it's probably our most popular page on our website, or at least it was. Last week, we published the CFIA and other public health partners COVID in animals dashboard on the CAHSS tools portion of our website, and it's already had thousands of hits. Another cool information sharing initiative we have got up and running over the last 14 months is a podcast series called Animal Health Insights that introduces listeners to the partners and organizations that work to support animal health in Canada. So the podcasts are between 20 and 40 minutes long, and Dr. Kate Todd is our podcast host. The themes of the podcast range from One Health and as an applied method to concerns about importing foreign animal diseases with rescue dogs to practical on-farm biosecurity to prevent diseases. We currently have 10 episodes available for download or live streaming, and we've had about 300 podcast episodes downloaded so far. In terms of building capacity, we are pleased to be working to update the minimum data set for animal health surveillance that was initially developed in 2011 by the Veterinary Surveillance and Epidemiology Network, or VISN. So we're using interactive tools such as Jamboard, discussion, and surveys to collaborate with our CAHSS members, VISN and other epidemiologists and laboratorians. And we're considering how to best integrate advances in laboratory medicine such as genomics. Just give everyone a moment to have a look at that because there's a fair bit of text on this slide. So another important capacity building project that we have recently completed is the case definition framework. And again, this was done in partnership with VISN, or the Veterinary Surveillance and Epidemiology Network. So this slide shows a summary of the steps in the framework. It's probably the second most EpiGeek slide in the deck, but the point is that case definitions are very important for surveillance. So it is very important for everyone to agree on how to count cases. In other words, being able to reliably describe what is or is not a case of a disease. So the case definition framework helps professionals through the process to decide what counts as a case. So for example, if a diagnosis of a case can be made on clinical signs alone or requires clinical signs and a positive laboratory PCR test. So the case definition framework is published on our resources library and it is available to use. And we are also able to offer support on how to use it. We're also working on a number of collaborative surveillance projects. So for example, early in 2020, CFIA identified a need for more fish health information from across Canada to bolster their ability to report internationally. So we worked with CFIA, our CAHSS Aquatic Network, and the Canadian Wildlife Health Cooperative to build a citizen science reporting tool to collect fish health data from the public. It went live last month and can be accessed through the CWHC website or via QR code. In terms of the important topic of antimicrobial use and resistance, our CAHSS AMU-AMR network have developed some interesting products over the last year and a half. These include a new backgrounder that describes antimicrobial use reporting terminology in user-friendly language so that we're better able to understand antimicrobial use reporting. It also includes an antimicrobial use reporting tool that partners can help to plan and develop their AMU reporting. So industry organizations, for example. We also developed a snapshot infographic that demonstrates who is doing what in terms of AMR and AMU surveillance in the animal sector. And the idea is that CAHSS partners can use this snapshot to showcase the significant amount of work that the animal sector is doing. And our plan is to keep that updated every year. Finally, we have been collaborating with swine industry stakeholders on the CanSpot ASF portion of the ASF project that Krista Arsenault presented last session. The primary goal of CanSpot ASF is early detection of African swine fever should it arrive in Canada. In August 2020, we launched early detection testing at laboratories, and early detection testing at abattoirs is slated to launch in the next few months. So we're really excited about the progress that's been achieved on that collaborative initiative over the last year and a half. As another component of enhancing surveillance for African swine fever, in fall 2021, CAHSS held a training course for veterinarians on smallholder swine. And the idea behind this is that if veterinarians are more confident in seeing smallholder swine, we will get more veterinarians on small holdings and strengthen the connections between these premises and the animal health surveillance system. This will build trust, and it will also get more submissions from smallholders into laboratories so that they're available for early detection surveillance. And we had over 70 veterinarians attend the 4-session training course. So that was nice. We're hoping to deliver the same course in French with partners from the University of Faculty of Montreal in the coming months. And finally, we're working on our very own sustainability plan as we prepare for the conclusion of this round of AAFC funding in March 2023. Only yesterday, I got the first draft of sustainability plan that we've been working on with a contractor with various options for sustainability. And once we've had a chance to study and refine it, it will be used by Animal Health Canada and CAHSS for long-term planning. So with that, I'm at the end of my presentation, Melanie and Colleen. I just have the links here. Doris will be very keen for me to point out that we do have a Twitter account, and we do present disease or send out disease alerts and other information, both by us and retweets from some of our partners on the Twitter account. So if you're a Twitter user, you may want to check that out.
Awesome. Thank you so much, Teresa. I am going to, there have been a couple of questions in the chat, and please feel free to pop your questions in the chat because Teresa is at our disposal. So the first question, let me open this up. This one comes from Quebec, and the question is around the goal of CAHSS. So you mentioned detection and emerging problems, managing of endemic diseases. And then so essentially just confirming that they have this right as far as the goal of CAHSS, so detecting and emerging problems and managing endemic diseases.
Okay, I'm just going to see if I can find the chat.
Oh, it was a private message to me, so you won't have that one. Okay,
yeah, that's correct.
Okay, great. And then question 2 was around the CAHSS information. Okay, not sure. So they're wondering about how they can sign up, what's public and what's private that they can see and access on a regular basis.
Sure. So we have our public facing side of our website, which is at www.cahss.ca, and many of our resources are public. Wherever possible, we try to make everything public because most of the time, the information that we want, the end users are sort of broad, and we want to include wherever possible. We also have a CAHSS portal side, and you can, if you join CAHSS, if you go to the website, there's a button up at the top that says join CAHSS, and then you have to complete a membership form that's validated, and then you become a CAHSS member. And at that point, you can log into the portal side of our website, and we keep things there like minutes from the networks, network priorities, and on occasion, one of our partners has a disease alert or report that they are comfortable publishing within the CAHSS community, but they don't want publicly published. So those resources are kept behind that portal wall. But I would say 85% plus of the stuff is available publicly.
Amazing. Yeah, there's a lot of information on there. So I would highly encourage you to check it out and join their mailing list and join as a member too. Another question here. So with many networks contributing to surveillance data, what does CAHSS have in place to avoid duplicate reporting? So for example, we count diseases twice or something.
Okay, so I would say, because we're a network of networks, certainly the concern about duplicating efforts is always fresh in our minds. But generally what happens is the information flows from local to national. And so we're getting that information from the people who are compiling it at the local or regional levels. So if I were to, for example, if I were to receive a report of any count of anything, it would always be validated with whoever at the local level would have that information at hand, is in charge of that. So certainly we wouldn't be publishing anything nationally until we'd validated it with the local, either the regional surveillance network or the epidemiologist in the province, that type of thing. Did that answer that question, or is there more questions about that topic?
Yes, I think so.
Okay.
Erin, Erica, let me know if that did answer it or not, maybe in the chat. Is there any other questions for Teresa? Okay, yeah, we got it there. Okay, perfect. So I'm not seeing any other questions there. I'm going to move into the Animal Health Canada update. And thank you so much, Teresa, for your time. I thought that was really great. And so many of you know my background, that I used to be the Ontario node of CAHSS's coordinator. So for me, it's just a real treat to be here and see all of the amazing things that are going on across Canada as well, and see all the work that's being done, as well as from our partners too. So thanks, Teresa.
Thanks a lot. And of course, if anybody has questions, comments, suggestions, we're always happy to receive those.
Absolutely. Okay, so I'm going to screen share and get into our presentation. And again, if you would like to see the presentation in French, go to the bottom of this bottom bar of Zoom, and you can press French. You can press on the interpretation button and you can choose that. Choose French or English, and then at the top bar there's a green piece that says that gives you, there's a little green bar, and then beside it says view options, and you can go in and choose which presenter. So if you're choosing me, Melanie Barham, then you're going to be getting the English version, and then we have a French interpreter version as well. So I'm really excited to share with you our monthly update. The reason that we did these webinars was so that we could share with our stakeholders, all of you, all of the initiatives that are ongoing within Animal Health Canada, as well as go through what's going on in our divisions and projects. And these are taking place every month until June and July, so that we can really share some of the things that are going on, and so you can get some ideas for what might work in your area of whatever part of whatever industry you're part of, or what other area you're in. And then of course, we'd like to give an update because our organization, newly named Animal Health Canada, is under quite a bit of transition, and we want to make sure that you as stakeholders are very informed and have the most up-to-date information about what is happening and where we're headed with the transition to our new model and new work plan. So without further ado, I will start with where we're at. So you may have seen this last time if you attended last time, but just so that in case you're attending this first time, in 2017, there was a working group called Animal Health Canada Working Group that was struck external to the National Farmed Animal Health and Welfare Council, which is our previous name. And they were working on how to respond better to emergency management situations and animal health and welfare issues. So they were really looking around to see what models were out there to be able to adapt and learn from. And out of that came a gap analysis of the landscape of what's out there in animal health and other models that might be present. And then there was also a governance study completed looking at, again, other models that might be present. As time went on, it really became apparent that the council was the correct place for Animal Health Canada to live and morph into. And that led to a members vote in September of 2021, where members of Animal Health Canada voted to adopt our new name, which is Animal Health Canada now, but was council, and also to increase our membership to be more inclusive along the value chain. So including all of the partners, not just industry groups and not just government, to include more partners so that we can really get a fulsome look at and get a really clear voice around the table of what needs to happen and have everyone assembled in the right spot. In December of 2021, we worked on creating a governance and strategic planning proposal to bring that forward to get to the final leg of the journey. There was a governance study that was done, but now what we need is to answer some very specific questions around governance and our new model. And so in January, we brought that funding proposal forward, and we have received support for that. So both industry, federal and provincial governments have supported that funding call, and we are rolling forward with that strategic plan and governance study right now. The other thing that you should note is that there are 2 pilot projects under Animal Health Canada for this coming year, as well as for last year. And they are quite large projects, so they're taking longer than 1 year to complete. One of them is the African Swine Fever National Project. And that project is one that has, that you heard about last month if you attended. And if you didn't, check out our YouTube channel because it will be up on there to give you an update. And I would encourage you, if you're looking to move big issues forward, I think this is a nice example of a model that could work to move issues forward in many other sectors and species as well. So if you've had challenges moving big problems forward, this is one area where I am so proud to, and I can't claim a lot of credit for it because the work is being done with all of our partners, but it has been phenomenal to see everyone come together and make some real headway on some very big challenging issues that with regards to preparing for a national emergency or a disease threat. And so African swine fever is moving into its 3rd and final year of funding. And during that year, we're going to not only be working on finalizing some of the plans to ensure that we're prepared for African swine fever as a country, but also looking at how to template those issues, template this way of decision-making, this way of bringing people together to collaborate and share responsibility for other species groups and for other diseases. So really, if you're interested to learn more, either get in contact with us or feel free to watch the webinar that was given last month. That was really excellent and just really gives an overview of where of what we've been doing and what the lessons learned have been. As you know, it's when we're collaborating, it's never a completely smooth road. And then the other one is development of a foot and mouth disease vaccine bank for Canada. So many of you know that foot and mouth disease is a big threat for a large number of animals in Canada. We have not, but it's something we prevent and work against every day. But looking at the development of a specific vaccine bank and the strategy for how to roll that out is the focus of this particular program. So we've created a white paper looking at the business case for developing a specific vaccine bank for Canada. And now the work is being done to roll into a strategy of how that might work as we roll it out. We've seen this with the COVID vaccine as it was rolled out throughout Canada. And it's so we can, I think if any of you have been around for the past couple of years in Canada, you'll know that it's very challenging to enact something like a vaccine strategy throughout the whole country. So this is where this strategy will come into play, and it's being worked on as part of under the Animal Health Emergency Management Group. To give you a little bit of background and context too, in the minister's press release since November, they had mentioned specifically Animal Health Canada and African swine fever as priority issues, and that we were requested directly by the agriculture ministers to have an update on progress at their July 2020 meeting. So that gives an idea of our timeline that we're driving towards. As our name has changed, here is a schematic of what our organization and how Animal Health Canada interacts with the Animal Health Canada Working Group and where our plans are at. Because it can be very confusing to think about, okay, where's, was Council, now it's Animal Health Canada, where's all of these things fitting together? So essentially from 2017 to 2021, National Farmed Animal Health and Welfare Council ran parallel to the Animal Health Canada Working Group, although we were the conduit for projects and were able to be the project managers and support the Animal Health Canada Working Group as they created the governance study, etc. 2021 to 2022, we have changed our name to Animal Health Canada. So you'll see on the larger rectangle on the left, we changed our name from Council to Animal Health Canada. And then the Animal Health Canada Working Group has been still external, but supported by us, and we've been working closely in parallel with them. And then in 2022, the plan is to include the Animal Health Canada Working Group as we increase our membership, and we'll be bringing it in-house essentially. Here's a timeline for 2022. You'll note that the timeline ends around July because our big milestone that we're leading towards is the ministers' meeting in July to be able to bring some more concrete budget and also concrete plans for what will be included in that scope of work and the value proposition of the new Animal Health Canada. So right now we're engaging in a strategic planning process. So there will be stakeholder surveys going out in the coming weeks, and then a strategic planning session taking place in March with a report in April. A governance study has also been commissioned, which I mentioned before, and that's on the go. We're expecting a report in May. We're going to be doing a rebranding, and that will take place after the strategic plan is complete. And then we are, as you know, we're doing webinars every month to inform our stakeholders of the progress on these reports. And then we'll be releasing later this month some report cards so that you can track as a stakeholder where we're at on these initiatives and where we're headed to. In the background, we're paddling furiously to get infrastructure ready to allow us to accept any new challenges that come along with, or a new work plan that might come along with the new Animal Health Canada. And then, of course, the financial modeling, because that's the piece that everyone who has to pay the bill is interested in learning about as well. So that's underway, and we're working on that as we gain more information from these two pieces, the governance and the strategic plan. We'll know a bit more about how the model will work. So to give you an update on the governance study, we've selected a firm, and I think she's started work already, the primary consultant, and they're going to be starting off with some background work and interviews. For the strategic plan, as I mentioned, with the stakeholder surveys will be going out soon, and then there will be a smaller session that takes place late in March. I've put early March, but it should be late March in there, and our report will be expected in April. Other actions and updates: we've secured funding for the African swine fever project for 2022 to 2023, and then we're continuing to work on the foot and mouth disease vaccine bank, and our first report card will be released later in March. So I would invite you, I would love for everyone who's on this call to just take one small action and go to our website, animalhealthcanada.ca, and make sure that you're signed up for our mailing list so that we can stay in touch, and so that you have as much information as you would like to receive. And I'd be happy to take any questions. So feel free to either unmute yourself or to type something in the chat. And before I take questions, I do want to mention that we are going to be doing something a little different at the end of this meeting. We know that one of the big things that people have enjoyed about Forum in the past is being able to network. So we've decided to do a networking session that will not be awkward, and it will be lots of fun. So if you want to stay to do that, we really encourage you to do so. We're going to do a couple of rounds in breakout rooms, and we anticipate it being fast and easy and not at all awkward. So I'm just going to look for any questions. Animal Health Canada, is it multi-species? Does it include small animals, or is it focused on food animals? Great question, Chris, from Quebec, Christian. So it does involve all species. As you can see from CAHSS and all of our divisions and projects, we cover farmed animals. That's always been the scope of work for the National Farmed Animal Health and Welfare Council. And unless something that may change with the strategic plan, but largely we're focused on farmed species. Although in the case of CAHSS and in some other circumstances, we have delved into other discussions depending on the scope of depending on the topic. So for example, CAHSS has a companion animal network, but focused on the public health and One Health issues that might come up. And we also work on select wildlife issues as well and engage with wildlife professionals as seen in our African swine fever file. How are commodity group priorities managed within a multi-species budgeting? I'm not sure. So if I can try to answer that question. So we have industry is part of our board of directors, and those have been our members. And so their needs, those commodity groups are present at the table, and they're part of how we determine our priorities as a board. So if that helps to answer, so multi-species budgeting, I think it really depends on, we need to, it's prioritization based on what our industry and what all the people along our value chain value, if that makes sense. Feel free to ask any other questions. Happy to take questions. Okay, seeing none, what I might do is we can actually jump right